As a counsellor working for the maternity services, I regularly see parents who are struggling with postnatal depression. I think it is important that they are aware of how seriously postnatal depression can affect their ability to function, their relationships, and their ability to bond with their baby. They also need to be aware that there is support available and that mothers do get better. Approximately 10 to 15% of mothers suffer from postnatal depression within 6 weeks after giving birth. This is different from baby blues, which is more common and is a brief period of feeling emotional and tearful and doesn't last longer than 2 weeks. Postnatal depression, however, is a deeper and more long-lasting depressive illness. It can come on suddenly or gradually and may last up to a year. Symptoms of postnatal depression include deep sadness, possibly feelings of worthlessness and hopelessness. There may be anger or hostility. Some mothers report feeling guilty because they feel indifferent towards their baby or their partner or life in general, and they may even have thoughts of death. Certainly sleeping and eating is usually affected, and she may go off sex. Some mothers report feeling extremely overwhelmed, exhausted, numb and isolated. There is no definitive cause for postnatal depression, although research has shown that the women who are more likely to experience postnatal depression have previously had depression at some point in their life. They may well lack support, have low self-esteem, or have experienced abuse. There could be financial problems, poor living conditions, and certainly hormones, post-traumatic stress disorder, or having had a traumatic birth may well contribute to the bigger picture. At the beginning of every pregnancy, health professionals will always assess a woman's risk for postnatal depression. If she is assessed as at high risk, they will always monitor her throughout her pregnancy and, if necessary, after the birth. Postnatal depression is a distressing and a disabling condition, and I would encourage parents to get help as soon as possible. As part of her self-care, I encourage her to speak to people that she trusts, family and friends. Tell them how you feel, ask for support. Set aside time to relax, rest and exercise, and eat healthily. I would encourage parents to inform themselves about postnatal depression, meet other new parents, and the sooner you get help, the more likely she is to shorten the period of depression. Most importantly, contact your GP or health visitor, who can, if necessary, refer you on for cognitive behavioral therapy or counseling, and if necessary, prescribe antidepressants. In severe cases, which is rare, if you feel very disorientated or disconnected, you have mood swings or hallucinations or feel confused, or if you feel that you may harm yourself or your baby, please contact your GP or the Berkshire Crisis Mental Health Team immediately, as this is considered a medical emergency. Approximately 4% of fathers suffer from depression within the first year after the birth of their baby. The symptoms are very similar to postnatal depression, and the triggers could be the responsibility of fatherhood, financial pressures, change of lifestyle, could be lack of sleep or increased workload. Their depression could very well be aggravated by the strained relationship with their partner, or if indeed their partner has postnatal depression. I would urge them to follow the same guidelines for self-help and support as postnatal depression. And there is a website called the Fatherhood Institute, which offers advice and support for fathers who are struggling. So please don't suffer alone. The key is early intervention, asking for support and working together. Don't be afraid of talking about how you feel for fear that your baby will be taken away. Postnatal depression is a recognized condition, and health professionals want to support you through it. Please refer to our list of helpful contacts.